First of all, let me invite all of you to enjoy a meeting in Milan, Italy, on the internal brace as part of the Internal Brace International Study Group meeting. And I apologize that I was unable to attend in person, but hopefully we can now have the talk done remotely for you. So I hope to give you some insight in this first presentation about how Gordon, Mackay, and I met related to development of the internal brace and our development of a strong friendship in the process of proving that augmentation with the internal brace can be a game changer, not just in the ankle, but in other ligamentous injuries as well. My first contact with Gordon came by email on March 15th, 2011, after he had already made a connection with Arthrex and Peter Denovi. As you read the text message, it's clear to see the prescient nature of it, which tweaked my interest. The first meeting with Gordon that I had was in June 2011, when Arthrex was considering Gordon's theories for using suture tape to repair lateral ankle sprains. I had been a consultant for Arthrex since 2004, before moving from Houston to Vail Valley in 2009, when my wife Kay and I joined our two married daughters and our first grandchild at the invitation of Dr. Steadman. I had previously done research at the University of Texas Medical School in Houston on repair of the lateral ankle ligaments using interference fit screws, which were an Arthrex product, resulting in my being a consultant for Arthrex. Arthrex knew that we had a surgical skills lab in Vail that Gordon could use to demonstrate his idea. This was our original surgical skills lab, which was rather small, but could serve the purpose for Gordon, as he showed me how he anticipated using the internal brace prior to giving grand rounds the following morning. His vision at the time was doing this in the emergency room for patients with acute lateral ankle sprains with instability. But at grand rounds, he also spoke on using it for ACL tears. At the time, this was just a bit beyond the vision of most of the audience. But my former knee and sports medicine fellowship director, John Fagan, praised Gordon for his ingenuity and forward thinking. That was followed by a nice dinner hosted by Dr. Steadman and his wife Gay that was preceding time when Gordon and I spoke privately, and I explained that I thought that doing the procedure in the emergency room was a little advanced for us here in the United States, but that it could be a definite benefit in the operating room for unstable lateral ankle ligament tears as an augmentation. And that is what I conveyed to Arthrex prior to performing the research to back that up. Our next step was to visit Gordon in the beautiful city of Glasgow, Scotland, and observe him performing his IB technique on a live patient. The picture on the left shows, in this order, Jim McWilliams, one of our doctors, Gordon Mackay, me, Peter Denovi, Felix Riano, and Christian Renner from Arthrex German office. On the right, you see Gordon operating on a lady with an unstable lateral ankle, demonstrating his use of the internal brace. This was when we really got to know Gordon and to appreciate his hospitality, as he invited all of us to his secondary home in Comrie, Scotland, just south of the Scottish Highlands. We had a great Scottish dinner with wine and some special coffee, but it is Gordon's fault that after dinner we were all introduced to true Scottish whiskey, I was not a drinker of alcohol up to that point, but Gordon told me that I couldn't come to Scotland and his home and not have an after-dinner drink of the Macallan Scottish malt whiskey. So the hook, of course, was the quality of the whiskey. So I continued to drink a little of that afterwards. The next visit with Gordon was also in Glasgow in June 2014, where I finally had the opportunity to honor my Scottish heritage and wear traditional attire. My feeling was that Gordon arranged everything with Jackie's help, his wife's help, and Kay and I had a spectacular visit. We attended a meeting of the Royal College of Physicians and Surgeons of Glasgow and ran into a friend of mine from college at Rice University who was actually speaking there as well. He was an internal medicine professor from the Mayo Clinic in Rochester, Minnesota, and it was great seeing him again since I hadn't seen him since we were at Rice together. I have stayed in contact for 13 years with Gordon, and we often reconnect at various meetings from those put on by Arthrex, AOSSM, or the Foot and Ankle Society. I've been pleased to have him come back to Vail, where I could provide a little of the first-class treatment that he and Jackie provided for Kay and me. I'm proud to know Gordon and to chair this meeting of the Internal Brace International Study Group in Milan, in spite of the fact that I was unable to attend in person due to health reasons. Thank you very much, and I appreciate all of you being here.